Three, two, one. All right. All right, we're live, but maybe not live. Okay, so for anybody tuning in, we never know when the live button actually is live. I want to make sure if Kim's mom is watching today that she doesn't think her computer is messing up. We want to make sure there is sound coming across because we have not just two, not just three, but four amazing guests on Calling Dr. Coffman today. I'm going to start with you first. Hello, Dr. Coffman. How are you?
Hey, Allison. How are you doing?
I'm good. How was your Mother's Day weekend?
It was fantastic. Very relaxing. And we're keeping with the Corona theme of eating too much, over the day. We,
Right.
we accomplished that. How was yours?
It was great. I think I told you, we actually drove to Birmingham. We did a social distance barbecue with my sister and her family in my parents' backyard. My mom's about, I can't tell you because she's probably watching and she'll be upset. They're in their mid 70s. And my mom's birthday is in a week or so. And so they haven't seen
Happy
anybody
early
in
birthday.
2 months. Thank you. So it was very good. It was cathartic and it was nice to all be together. So.
Now, did you have the spring in Birmingham moment where someone sneezed and everybody stopped and made sure that that person didn't have coronavirus?
Yeah, no, my dad did pull, this is like the true Jewish guilt. In the middle of lunch, he turns to everybody. We're all basically spread out across their backyard. And he goes, by the way, if anybody gets sick after today, please don't feel guilty. Please. And I went, well, I wasn't thinking about that before, but now I do feel a little guilty, but thank you, right? All right, so I know you're probably wondering if you're watching who the other two Brady Bunch squares are today. Well, one should look familiar, Dr. Kim Gaines-Eckert, and now her husband, Jeff. He was so jealous that we were talking to Kim. He wanted to get on the bandwagon with calling Dr. Coffman. This husband and wife dynamo team are not only licensed clinical psychologists, but they are also the co-founders of Roots Counseling Center. And I know they have been practicing together and privately in their own practices for years. And today, last week we were really talking about anxiety. Today we really wanted to talk about something tangential, but this is the idea of dealing with loss and grief during COVID-19. And we know there is really a spectrum of this, Dr. Coffman, right? There's this spectrum of loss and grief, right? We talked about how everybody's might be in the same boat, but not everybody's in the same storm. Let's talk about how that looks. And then Doctors Eckert, let's talk about, some tools and advice on ways people can really handle it and also talk about it with not only their partners, but their kids, their parents, their friends.
Yeah, I've been amazed. Just we keep saying it, but what's been going on around coronavirus has touched so many parts of our lives, and there's the part of the newness of it and what we're learning, and there seems to be something new we've got to do every single day, and then there's the new revelation of, oh my goodness, it's affecting this too. And in my life personally, the business part of it was such a shock at the beginning, and having to make sure that my employees and my other partners and our patients were safe, and then to realize that I financially this was going to be a big deal, and we had to change how we were doing our employees, and I might not be able to keep them all employed. Unfortunately, we've been able to do that, but that was a big sense of loss, and then coming into I was very surprised. Just, I think the biggest thing for me personally has been my middle daughter's lacrosse season. She tore ACL last spring and had put a ton of work trying to get back and have a good year this year, and was interested in potentially getting some attention from colleges, and that just went away. And realizing, like, she was disappointed, but I didn't realize how much I was disappointed because I was so looking forward to seeing her play and have fun and have some success and payback from all the work she had been doing. And just realizing that there's so much loss, and I think we're just going to continue to see that as we move forward. And I know you and I have talked about that a lot, Allison. How has that affected you personally?
Yeah, I mean, so we've got our middle son is a senior in high school, so he's lost out on that. Our oldest has lost out on the end of his freshman year experience. Our youngest is now missing out on the last year of his amazing summer camp experience. And I think we're all sad about it, but we constantly feel a need really to put that in context of the loss across that spectrum and be really respectful of other people's loss, right? Like people have lost their jobs, people have lost their lives, their loved ones. There is the spectrum. So it's really, I've been thinking about this and struggling with this personally of how to really counsel our own boys of how to recognize it and to give it a name and talk about it at the same time, knowing that they are all, and we all, I think the four of us are these social justice warriors too, where we care about other people and their health, which brings me to, Kim and Jeff. I mean, is there a good way to grieve? And what does that look like, if so?
And how do you even know? Like Alice and I have joked about how we grew up, don't talk about that. How could you complain about yourself because other people have it worse? Like, I think, for us, it's even hard to know what we've lost and give ourselves permission to grieve.
And I'll jump in there. And what you just said, Alan, really fits with what I wanted to share, which is just that range of different kinds of grief. And it's easy to want to beat ourselves up for certain grief that doesn't seem as significant. So, for example, my boys and I do an annual boys trip every summer. And in our family, we're all big, other than maybe mom, we're all big WWE wrestling fans. So this weekend, we were planning Friday night to be at Friday Night SmackDown in Greenville, South Carolina.
Sweet.
And that trip has been postponed. And with the level of fandom in the household, there is a sadness and there's a loss and there's a grieving. Now, we all, I think, can see a bigger perspective on bigger losses, but it's okay to feel sad that we were heading to a wrestling event together and going to connect and bond and have fun at something that we're not going to get to do now. So to be okay with that and be able to talk about that, and for the four of us who are going to go, to sit around and talk about it a little bit and feel sad and talk about that and be okay with that and not feel like, wow, in the midst of everyone losing jobs and people dying and people with their worlds turned upside down, it's okay to be sad about a wrestling event that got missed.
I thought you were going to say you were reenacting it now in the living room, like the goal.
That may happen as well.
How do you keep your eyeballs from hurting from rolling so much as you're trying to hear that and validate those feelings?
Well, my youngest is 7, so it's not hard to feel sad for the 7-year-old who dresses up and reenacts on like mattresses on the floor that he wants to go. I think in terms of coping with our own grief, one of the things I keep thinking about is a pain scale. When you go, when I had my kids and I go to the hospital and I hate that question. I think a lot of people hate that question, like rate your pain. And it doesn't help for you to try to imagine what is the pain of the person in the next room. You can't know. You can't be inside their skin. You can't know. And it doesn't help them for you to say, well, they're probably hurting worse than me, so I'm only a 2. I mean, we only live in our own skin and with our own, with the losses that are particular to us. And so I think in some ways, in terms of practical ways, part of it is naming the pain. So it's a little bit like that pain scale. So it's naming and identifying the loss, not in a comparing fashion, but just in an ownership. This is a real thing. It's a real loss. We are embarking on a lot, not every family and not every person has a family, but going on trips, lots of people have events planned over the summer months. And it's just so much compounded, like there's grief compounded with anxiety, right? So not only are the trips canceled, but then, as a working mom, my kids are older now, but I have over and over and over been thinking about all of the working moms who suddenly have no childcare, right? School is education and also childcare when you are at work. And so there's both grief and loss compounded with what it brings with it in the kind of practical aspects as well.
I was going to say it also, like, as I'm hearing both of you, talk about grief and loss on sort of like the 50,000 level, we think about loss of control, right? Loss of knowing, like, I'm such a planner, right? I will plan vacations and trips over a year in advance. My kids think I'm nuts, but like, I like knowing, like, I'm a type A who thinks she's a type B. It's the worst kind ever. So, but I realize, right, like, just the loss of that control, the loss of being sure about something, the loss of being able to plan, the loss of being able to reassure our kids. And even, and some of it, it's a little bit liberating to talk about it, right? And to admit to my kid when I say, no, you can't do that. And he says, why? And I go, I don't know. I'm doing the best I can, right? It feels like, I feel like I've lost sort of credibility as a parent, right? When you start promising or suggesting things, and then the reality is they look at you and go, you don't know either. And you're not a medical expert, and even the experts don't know.
Which is true, right? Your kids are smart.
Do you think there's some key, in y'all's practice, are there some key things that we need to pay attention in our own lives and in others right now? Thinking about folks that are grieving loss of family members or marriage or children, and coming into this time that would be especially difficult.
I can't see Jeff, and so I'm wondering if he's going to jump in or wants me to.
I'll jump in here. I'm seeing a lot of social loss for people where they're feeling depressed and isolated, and the level of alienation they're experiencing. I sit with a number of single clients who have been in apartments for weeks and have told me I've hardly seen a live person in several weeks, and my depression is so heavy I don't know what to do with it, with that feeling of isolation. And so I've actually welcomed them to come back into my office for social distancing therapy sessions, because the feeling of sitting in a room, even if it's 8 feet away from someone, and having that person ask you questions and be curious and care for where your heart is at, I think is really powerful in this season. So I would encourage people to find ways to stay connected in the midst of their grief. And if we see someone around us who is grieving, to reach out, because, for example, that individual I'm mentioning, he wouldn't have asked for that in this season because he wouldn't have known that was an option. So I offered that to him. So I think looking for opportunities to offer to others an opportunity to sit in that grief together, and to be able to sit and maybe not even have a lot of answers, but just to sit and talk about where we're at and how we're feeling.
I've had more than a handful of well visits where the parent said, they're fine. We don't need to talk about them. Like, what are you reading? Have you watched a good TV show? And you're like, wow, this person needs to talk to somebody, that's what we're going to do today,
Well, I think too that, the combination, and you mentioned this earlier, the guilt for the grief it is complicating doing some of the grieving, because we all know it is worse or could be worse for someone somewhere, and we're hearing stories and we're seeing stories. And so I think about that, like having it in both hands, right? So having the grief of the loss that's so multifaceted in one hand, and then often having this guilt, or, on a positive, to put that from a positive perspective, the perspective, right? The perspective of the bigger picture of how people are suffering, but that we can hold both of those things, right? We don't have to shut down the grieving, and that in fact, there is something really necessary and healing about naming that. My one of my best friends is a therapist in New York, and she has messaged our group. In 1 week, she had two COVID-related deaths that were connected to her, and she asked at one point, "Is this too much? Like, is it too much with the death in this group message?" And we all were like, "No," because there is in the context of so much loss, there's actually very little space for grieving, which seems strange, but there's just so much. And I think, so many of us then pull it back in because we don't want to take up space, right? Because it wasn't but there's so much and even like actual death grieving is so complicated and so painful right now. So not being able to have a funeral, not being able to go, not being able to sit and touch and hug the people that you love, and that expectation and the ritual that is around saying goodbye to someone that you love is so drastically affected.
Allison, can you speak to your experience this last couple of weeks with that?
Yeah. So, Alan and I were talking just about that, Kim. And my husband and Alan and I, we've already been to one Zoom funeral, right? And the immediate family was graveside, and we all were just on the computer, but it still felt, there's something still sacred about being present there. And then one of my dearest friends from childhood lost her mother last week. And in Judaism, there's really a prescription for grieving, and it's called Shiva. And it's really, Shiva is a Hebrew word for 7. And it starts with these 7 days that you're really supposed to be isolated in your home. You cover the mirrors, people come visit you. It's even so detailed as to when someone comes to visit, you're not, our tradition is like, as Southerners especially, get up, greet everybody, like you're supposed to stay right on a lower chair than they are. And it's in all these things. And it's actually, to me, one of the most comforting parts about my faith practice, because at a time when you feel so lost, right, and you don't know which way to turn, it lines out, this is what you do for 7 days, this is what you do for the next 30, and this is what you do for the next year and beyond, right? And it gives you an out. It's pretty amazing that in quarantine feels the same way, right? Like, I wish this COVID quarantine had said, cover your mirrors. You don't want to see yourself, right? Like this, don't worry about, don't have the ego in that. And so my friend, she's figured out a way, like I know people are doing what they're calling drive-by Shiva, because I think a lot of us, right, like for some of us, our love language is the hugging, right? And the touching. And when you lose that community, and Jeff, to your point, right? Like just even being in the same space, right, is comforting. People are having to drive by the house and offer condolences, and we drop off food. That's a big part of it, and you want to be safe. I have a Zoom appointment with my friend Gail to sit Shiva with her, to just really just to talk about her mom and the memories. And the beauty is, she's not grieving the loss of this tradition in the sense that we once knew it. She has really, and other people I know have really, and here comes the word of the year, pivoted in a way that is making it not just practical, but meaningful. And I think it's such a lesson to me, right? Like when we talk about what does that prescription for each of us look like, and how do we connect even when we're in isolation, and how do we find community even when we feel probably the most alone we have felt physically and just realistically. So
what do you all feel like are some simple ways that people can kind of approach it? Because I think most of the time grieving for ourselves and helping, reaching out to others is so intimidating, and you're so worried you're going to, either it's not going to end, or I'm going to go someplace that I shouldn't be. What are some kind of basic rules that you kind of give people and give as that you're coaching them through that?
Alan, I've had to give a lot of permission the last week or so for people to cry. I have people weeping in my office more than I've probably seen in a long time. And they're apologizing for their tears. I'm so sorry. I shouldn't be doing this. Those kind of phrases. And just saying, hey, this is good. This is cleansing. This is good for you to do. I know it doesn't feel comfortable. I know it feels awkward. I know it feels unsettling because you're not used to this, but it's okay. This is an okay spot to sit and shed tears, and maybe we don't do a whole lot more today than that. So just once again, that permission for the grieving and for the expression of that for people who normally don't express it in that way. Because a lot of the people I'm seeing who are crying are not people I've ever seen tears from and working over a long season with them.
When I think what that involves is giving permission and normalizing both for yourself and for other people. Like the prescription, Allison, I'm thinking about sitting Shiva, is so beautiful because it lets other people know what to do, right? We want to support and love the people that we love when we see them hurting. But we don't know what to do. We don't know what to say. And that's on a good day, right? In the midst of all this with so many additional aspects, it's even more complicated. So I think even in that most simple, giving yourself permission, normalizing that grief is normal and that it ebbs and flows, and that there's going to be good days and hard days with whatever the specific or particular aspect of the loss, but then also doing that for other people as well, not forcing them to do anything. But I mean, even in that, I think what Jeff, that example of, people do apologize for crying all the time. And when that happens, to say like, it's a gift. I mean, it really is. If somebody trusts you and to talk and to share and to be vulnerable in that way, to thank them for that, for trusting you, and to be able to normalize that for them, whatever they're feeling, right?
Yeah.
I mean, going back to the blessings thing, it's one thing. Thinking about being appreciative of the blessings in our own life is a different thing than saying to somebody else, like, well, you should remember and think about all of these other people, right? In that moment, leaving that aside and just being present in that, and even verbally going beyond being present and saying, thanks for trusting me.
Yeah. And I think nobody ever complained that too many people reached out to them to
Right.
offer an ear, to offer
Right.
a comforting word, right? Like we've been reaching out to people within our community. I live in a gated community, and there's a lot of senior citizens, and just saying, if you need groceries, if you need this, right? Are you okay? A friend of mine called somebody in our community who is like 93 years old. And she said, thank you just for calling. I thought nobody remembered me, right? And Jeff, you saying that these people who live alone, right? Like, it's one thing to be alone. It's another thing to be lonely and to really feel like the world has forgotten you. So I think that's a gift for all of us, right? If we can all just like intentionally reach out to at least one person, right? And I think that's the nostalgia has come in. I've reached out to people so far back in my childhood. It's like, you don't remember me? We were on the same JV basketball team in third grade. Come on.
I can imagine you having the third grade picture so you can prove to it. That's the Allison level of preparation.
I'm putting it up there for next week. But look, I know we've gone over our traditional like 15 to 20 minute mark, but Kim and Jeff, you have been a blessing and a gift to us to really sort of put a name to this and give us practical tools to handle this, right, and to address it. Kim, I will tell you, since last week, I'm still using breathing techniques that you have given me, and I've told everybody I'm like the breathing like czar now. I'm like, just breathe. It's so simple. It's not that simple, but it is helpful. Dr. Coffman, I also, before we go, just to give our viewers a little bit of a taste of what's going to happen on Sunday. We will be back Sunday, but I know we have a lot of people who have been asking sort of practical questions. We're going to talk about masks. Your reminder, we're going to talk about masks. Yes, and we're going to have a practical but hopeful discussion on Sunday with answering some of your questions. Real quick, though, one of our viewers, Lisa, had asked me about returning to her gym, which recently opened this week, and what you suggest. And then another viewer we have, Kate, was asking about late summer plans to go on an extended family vacation. They would all be related, but all would be in one big house together, and what you think pragmatically about that.
Yeah, so great questions. Any enclosed space is going to increase the risk of transmission. Anything that you're doing where you're breathing heavily, screaming, singing, the CDC released a study just yesterday in regards to a choir in Washington State where most of the choir got COVID from one sick person, and it showed the airflow in the room, how it spread across the choir. If you're in a room where the air vents are, where air is coming out, is going to be the safest place in the room. So if you built a house and you know how airflow, where the air exits, where the uptake is probably the most likely place to get COVID. If you're in a room, that airflow is important. And so if you're in a gym and the vents are right there and the air is blowing past you, that's a safer place to be. Sharing equipment is not something I'd be excited about right now. A lot of gyms are being really thoughtful in how they're cleaning those. But if like a line of treadmills or bikes or or those kinds of things, ellipticals. When someone's breathing really hard, we really don't know how far the particles can be shared. And if you're touching and wiping your face and drinking, those are pretty high transmission spots. So especially with the number of cases going up as we loosen things up, gym is not a great place to be right now. Vacations are completely reasonable. I think, what I'm telling people is your COVID bubble, the people that you are expanding your interactions with physically, so people that are serious about hygiene and are practicing good social distancing or being smart about their activities, it's reasonable to start bringing those people that you need back in your life. So grandparents and friends and your kids' friends. That's hard. I think in our family, we've seen there's things that we've wanted to do where other families were not even willing to ask people to wear masks to come to an event. And so we said, sorry, we're not going to come. And so with your family going, your protection from COVID is only as good as the biggest idiot in your family. So, each family's a little different. And so I think be thoughtful of that. I had one family I was talking to this week that had a family member flying in. And so and they were very worried about, like, are they going to be exposed to coronavirus on that flight? And then there was going to be a wedding. And, to be honest, they're pretty low risk immediately after that travel, but where, a week from now, they would be higher risk. So those kind of things, as you look at it, if you have, two grandparents that have been making good decisions, a brother or sister who's going to come, and they've been doing those are real low risk if you're all going to be in the same place and not eating out in restaurants and being careful about going to the grocery store, and those kind of things. I'm very excited about Sunday. We're going to be talking about just the remarkable, almost miraculous amount of science, both biologic and medical, that's been happening in the last 3 or 4 months. It is amazing what we're seeing. And so we're going to reiterate the importance of wearing your mask, good social distancing, making good decisions about what you're doing in public, because the more we slow down the progression of coronavirus, the more people that are going to survive. We're literally going to have people, probably on the order of thousands of people, who are going to die in the next 3 or 4 months, that if people had made better decisions and they had survived, even if they got sick, by Christmas time, January, we're going to have better treatments for coronavirus, and the death rate is not going to be as high. And so I want people to be very conscientious about that, because you would hate to think that I lost my grandmother because we made bad decisions, where if she had gotten this a year from now, she wouldn't have died. And it's very similar to what we see now with HIV and AIDS. So, when I'm old enough that I was in college when HIV hit the scene, and actually did some retroviral research in college. And so that science that took 10 years for HIV is happening in months with coronavirus. And now, we have people who get HIV and live their entire lives without progressing to symptomatic AIDS. And I think we're gonna be at that place with coronavirus. So I just want to give some hope, and we'll talk more about that on Sunday.
Well, good. Well, as always, Dr. Coffman, thanks for letting me call you to ask you anything and everything under the sun. Kim and Jeff, thank you so much. I think you may be joining us for one more week next week.
I'll be there next week,
Okay,
flying
great.
solo.
Great.
Yeah.
Well, you've proven yourself today, Dr. Eckert. So you're well trained, and just having the two of you as a great source of support has been a blessing. And as always, Dr. Coffman, I want to wish each of you the opportunity for grace and gratitude in your life. Be kind to others. We shouldn't have to remind ourselves of that, but in this day and age, kindness is actually an essential. It is not a luxury item. It is an essential. And give yourself and others the space and permission to grieve whatever loss you might be experiencing, to cry whenever you need it, and the opportunity to move on to happier, healthier, more hopeful times. So thank you all for being here today.
Thank
and
you,
thank
Jeff.
you all
Thank you, Kim.
for
Thank
watching,
you.
and we'll see you on Sunday. Thank you.
See you, Allison.